The next recommendation to consider to lower risk of diabetes is reduce your blood pressure. This is the study. It's available in PDF format in the resources section of this course. The study was published in the International Journal of Epidemiology. The impact factor of this journal is 7.70. Any journal with an impact factor of 3 to 9 is considered good, whereas the average journal's impact factor is a 1. The study was published in June 2009. It was a prospective cohort study. Over 25,000 adults were included for a median follow-up period of 8.2 years. Let's take a look at the results. The results are broken down for men and women separately. We'll start with men first. The results showed that anyone with a blood pressure that was even mildly elevated had an increased risk of developing diabetes during the follow-up period. So compared to someone whose top number systolic blood pressure was 109 or less, risk of developing diabetes increased in men with increasing blood pressure. The same held true for women. Compared to a woman whose average top number systolic blood pressure was 112 or less, as blood pressure increased, so did risk for a woman developing diabetes in the follow-up period. We can contrast this with the data on mortality for blood pressure. The mortality data suggests that a blood pressure less than 130 is ideal, and anything higher than 130 increases mortality risk. But if you're specifically dealing with elevated hemoglobin A1C, then your goals for blood pressure should be even lower than that suggested by the mortality data. In other words, if you're a man, your blood pressure goal should be 109 or less systolic. And if you're a woman, your goal blood pressure should be systolic 112 or less. If your blood pressure is elevated, I strongly encourage you to take my online course on how to lower your blood pressure.